First, I want to give some introductions here. We have really, truly experts in the industry in front of us. So I'm going to start on the other end there. Connie Bartu. She is on OVD staff here. She has 25 years of experience in human resources in manufacturing, service, and nonprofit sectors. She currently serves as our compliance specialist, and she provides guidance on a range of things to OVD clients. I have yet to find an issue that Connie hasn't run across. So when I come to her and say, my client's in this jam, we need some help, Connie is a great resource for that. In fact, many of you have said to me, where's Connie? Because you talked to her on the phone, but you haven't met her in person. So she's a fantastic resource. Next up is Lisa Cooper. Lisa Cooper is the Chief People Officer with a newly formed company, Cooper People Group. Many of you may recognize her. She's a local HR she established this local HR advisory and consulting firm focused on providing HR and business solutions to entrepreneurial and scaling organizations who have no limited or stretched too thin HR teams. With more than 20 years of experience in HR leadership and consulting in West Michigan, she's served as a generalist, a business partner, director, consultant, and vice president. She has 3 teen daughters, a new puppy. She loves people, bacon, and scuba diving with her husband. And in her spare time, she volunteers on a host of boards, a few of which are AHRM, which many of you are a part of, the Downtown Market, and North Connect. Lisa is a fantastic resource as well. Next up is Kimber Bixby. So Kimber is the team lead for our claims department. So if any of you have questions related to work comp, she's going to be the resource for us today. She has 10 years of experience in this industry, specializing in work comp claims and return to work programs, which if you know anything about OVD, we really stress that, trying to save you on costs in the long run. Her background is in health and safety management with a passion for getting people back to work quickly and safely. Next up is Nikki Pelty. So Nikki actually is our OVD internal HR director. And she has a little over 10 years of experience in HR. She is a SHRM certified professional and has worked in hospitality, professional services, nonprofit, and real estate. She keeps so many plates spinning here and does a great job of it. She assists with internal conversations, but also can be external facing. If you guys have a question, you can run past her as well. All right, so as you can see, depth of knowledge here. We're gonna go ahead and talk through with starting out with FMLA 101. So if you have these slides printed, and if you don't have these printed, we can have someone run them over to you. Just raise your hand and we'll have somebody, Bruce, I'm sure will volunteer. He'll skip over to you with one of these handouts. So we're going to talk through what FMLA is, because generally when we're dealing with leave management, that's the elephant in the room. So we'll start out with Nikki.
Thank you, Rebecca. So FMLA 101, Family Medical Leave Act of 1993. So in a nutshell, it provides 12 weeks of unpaid job protected leave, and it'll give a continuation of group health benefits if that's applicable as well. FMLA medical leave eligibility. So this is the big one. So we need to have 50 employees to be eligible. Now that's not 50 full-time equivalent. That is 50 heartbeats, 50 belly buttons, however you want to count them. It needs to be 50 employees. When you're in the private sector, the look back period or the count period to know that you're an eligible FMLA employer is for 20 weeks, 20 work weeks in the current or preceding calendar year. Did you have 500? Did you have 50 people on your payroll or within your payroll HRIS system? If that's a yes, you guys have now become an FMLA eligible covered employer. Public agencies aren't so lucky. They are FMLA employers no matter your employee count. So once you determine, yes, I'm FMLA eligible as the employer, who's an eligible employee? Anyone that has worked for a covered employer, yep, we got that. Anyone that has at least 1,250 hours in the preceding 12 months, and anyone that works at a location where a company employs 50 or more employees within that 75 miles. Some things I do want to point out, when you're counting for an eligible employer, if you have multiple companies under a control group, maybe you have 10 or 15 at each individual, let's say you guys own a Subway. You've got 10 or 15 employees and you've got 5 restaurants. You guys are considered an FMLA employer if they all are within that radius. All right, family medical leave reasons. Serious illness. So what is a serious illness? Probably if an employee came to you, they're going to think their illness is serious. But that is going to be up to the doctor to decide if it is a serious illness or not. It's going to cover birth of a child or adoption. It'll cover to care for an employee's spouse, a child, or a parent with a serious health condition. And it'll also qualify for some military reasons as well. So what is a covered family member? So that's going to be your spouse, your son, your daughter. Spouse is either going to be your husband or wife as long as the marriage is legal. However, when it comes to children, there's a thing called local parentis, which basically refers to a relationship in which they put themselves in the situation where they are the caring parent. So potentially it could be the aunt that raised the child, the grandparent that raised the child, or vice versa. At the end of the day, as long as the certification paperwork is completed, that's what we're going to go off of. Types of leaves. I feel like we all roll our eyes when it comes to intermittent leave. You've got the continuous leave, right? That's pretty cut and dry. Someone's having a baby, there's a surgery, you know, things that are easy to determine. But intermittent leave is sometimes a little bit more disruptive. You know, you've got the people that want to be off on Mondays and Fridays, afternoons or whatnot. So at the end of the day, it's reviewing that certification paperwork that we get back from the doctor and following it. So it's not fully your call to decide. Once they're eligible, once the employee is eligible, you get them the documentation, and if they have a doctor that completes the certification paperwork, then that means they're approved for that leave, whether it's that continuous leave or whether it's the intermittent leave. All right, paperwork. So there's a lot of forms that are needed. So the first form is going to be your general notice poster. This is the poster that you have to have up to say that, yes, we are an FMLA employer. If you do not have this poster listed, there are fines in place, and the employee could report you to wage and hour. So that's going to be your first thing. An employee comes to you and now says, okay, yep, I need a leave, whether it's continuous or intermittent. You'll give them their eligibility notice. This is basically informing the employee, hey, yes, you've worked here a year. You have 1,250 hours, and you're for a covered employer. Yes, you're eligible. Or no, you're not eligible based on, you know, you haven't worked here a year, you haven't put in enough hours yet. You also then will follow up with their rights and responsibilities form. This is just kind of a simple one-pager, so they know their rights under FMLA. The next thing, you kind of have 2 paths to go down. If it's for a medical reason beyond just bonding for a baby after birth, you'll have them do a certification form. So whether it's for the employee or their spouse, those are 2 separate forms. You'll fill out your first portion, hand it to the employee, and then within 15 to 25 days is typically the range that I like to give. You'll get the information back from the doctor, and that'll be certified that, yes, this employee needs this leave. This employee needs to be off work for this continuous time. This employee needs to be off work every Wednesday for this reason. It'll detail it out, so then you'll be able to follow it. Once you get back.
For the eligibility notice, that's a physical piece of paper that must be delivered to the employee, whether they are approved or, okay, so it's something that's physically given to them.
Or email.
Or email, okay.
Yeah.
And Department of Labor has these forms. I mean, it's easy to download them, so you don't have to recreate the wheel. DOL makes it pretty easy for us to comply as employers with that.
Okay, thank you.
So then we get the certification form back. Now we can give them their designated notice. Yep, your leave has been fully approved. Nope, we need more information. Your doctor wrote, we can't read it. We need to have to fill it out again. You know, there might be some back and forth, but at the end of the day, the final thing is you're giving them their designation notice, and now you're going to be tracking their leave, whether it's that continuous leave or that intermittent leave. So this is our fun little graphic. So what did we just learn? We start off, we're a covered employer. Yes, no. After that, you're a covered employer. Have you displayed your general notice? If you've not displayed your general notice, I believe the fine is $163. Pretty de minimis. Just display the notice. The employee comes to you and says they need FMLA. Now, an employee is not going to come to you and say, I need Family Medical Leave Act. An employee is going to come to you and say, I'm having a surgery, taking care of my mom. My dad's in hospice. So as HR professionals, you need to say, oh, nope, that means you need Family Medical Leave Act. We'll get you the appropriate paperwork. The next step is we're determining if the employee is eligible. So we're pulling payroll records. Okay, have you been here a year? Yes. You work for a covered employer? Yes. You worked more than 1,250 hours in the past 12 months. Perfect. Now we're determining, and we're giving them that eligibility and rights form and the appropriate notices. At that point, we're determining, do we need to do the certification process? If it's for a serious health condition, whether it's for the employee or for a spouse or child, yes. If it is just for baby bonding, that is your shortcut around, because you do not need to do a certification notice if it's truly just for baby bonding time off. So whether you get the cert or not the cert, you then determine, okay, you give them the designation notice, the leave has been approved, and then at that point you maintain the health benefits if they're on healthcare, and the last very important thing is you track their time. So it's very important with intermittent leave is you want to make sure all of that time is tracked because you don't want it to go over. Same concept with continuous leave. I typically like to make some sort of schedule for the employee, say, hey, your leave starting on this day. You wanted 12 full weeks. You started on a Thursday, so we expect you back to work, after 12 weeks in the middle of the week because we don't want to go over. And then obviously we want to maintain all of those records at least for 7 years.
Is there a definition of a child age? Like once they're 18, are they not considered a child in it?
That used to be the thing. Unfortunately, they've said that if the child's illness qualifies as a disability under the ADA, which many of them do, they can actually take care of adult children. I have had employees with married adult children that have gone and taken FMLA. So I would say proceed carefully if you're going to deny for adult children. Additionally, there are some military leaves that it definitely applies because obviously only adult children can go into the military. So you need to proceed cautiously if you're going to deny leave for an adult child.
And look to the ADA of what's
Correct.
For like an intermittent leave, I got a certification back that said it would be about 3 months. Like, do I require an additional certification after that 3 months is up for her to continue taking an intermittent leave?
So let me repeat the question so that, because I'm not sure that the sound is thick enough for those remote folks. Do we require recertification?
Want me to take it?
Sure.
Yes, absolutely.
So you can re-up how often for that recertification, right? So if you,
Question.
okay, so every year, right? So you've got someone who takes 12 weeks every year. We've
Well,
all
she
got
just
one.
requested an intermittent leave, but the paperwork that was certified by the doctor that she turned in says it would be for about 3 months. It didn't like specify like 12 weeks or anything like that. It said, she would need, so many days off for the next 3 months. And that was it.
So in that case, we would touch base with the doctor after that 3 month time frame. I'm sure the employee will come to you and say, hey, I want this extended if that is the case. And then more paperwork will be needed.
So to frame this just a little, yeah, I'll grab your question in just a second. So to frame this just a little bit more, you know, it sounds like a lot of steps, right? For the employee to go back and forth with all these forms and have conversations with them. But really the goal of FMLA was to protect employees from losing their jobs, right? So remember, keep that in mind. This is not just an administrative step. You know, make sure that you've got documents in your files. You don't need any more of those. But it is to try to ensure that the employee is protected in both their job and their benefits. Because as you know, carriers, insurance companies are not going to cover the employees on the insurance policy if they don't have an approved leave. They are now all of a sudden, without an approved leave, they are not an active employee and are booted off the plan. So it's just important for you to make sure that those ducks are in a row to protect your employees. But make sure you communicate that to them too. Right? If they understand, oh, this is for my benefit, it would go a lot further than having those conversations. Did you have a question in the back?
I did. With like the intermittent leave, is that a calendar year or is that a rolling calendar?
It really depends on how you have your FMLA policy.
Okay.
So the most common way to have your previous 12 months is going to be a rolling 12-month period backwards from the date the employee uses that FMLA leave.
Okay.
I would say the second common reason or way to calculate would be a calendar year, you know, just a basic January through December. But that could get tricky if you have an employee that has a leave, you know, starts in October, so uses, you know, 2020, now it's 2021, and it's reset for them. So they could potentially be off work for 24 weeks if you went that route.
Okay.
So what about in the same calendar year when their 12 weeks is done, but they're not ready to come back due to illness, family, whatever the reason is that they were off? What do we do then?
Good question.
Well, they're no longer protected under Family Medical Leave Act. At that point, do we need to look to see if it's something with ADA related and some sort of accommodation? If that's not the case, then it's making the tough decision. Do you want to keep them on or do you want to discharge your employee then?
Okay, because after that 12 weeks, we no longer are required to
Hold their job.
do the insurance and stuff like that for them, right? Okay,
Yeah.
In fact, you shouldn't.
okay.
And as we march down through the panelists, Lisa will be talking about how that interacts with Cobra. So once your FMLA expires, flipping over to Cobra.
Okay.
Yep. Any more questions on the general FMLA? Otherwise, we'll move along.
Oh, look at all the.
No, I'm just,
Oh, look, it's workers' comp time.
Do we want to save some questions for?
I think, yeah, let's just save a couple. If you could just jot them down, we'll save questions for the end, and because we might be addressing those in the conversations we have coming. So go ahead, Kim.
Probably not in my conversation, but that's okay. We can transition out, right? So I'm going to be covering workers' comp today. I'm going to be talking specifically on Michigan today, but if we have other state questions, come see me after, or I'll make sure you have my email address and we can always talk about them outside of this, okay? So today is Michigan specific. So most employers in Michigan are subject to the Work Comp Act. There are very few exceptions to that rule. The law basically requires that every covered employer must provide some way of assuring that benefits are paid to its workers if they become injured or ill while on the job. So this means that we have to be ready to have medical coverage, wage benefits, vocational rehabilitation, and death benefits if somebody is injured or ill while in this course and scope of employment. Most employers do this by purchasing some type of insurance policy, right? Either a traditional work comp policy through a private insurance company, through some kind of self-insured fund, or through a group fund. If a worker is injured on the job, you have to ensure that reasonable and necessary medical treatment is provided promptly, and that needs to be reported to your insurance carrier on a work comp form 100. That is a state required reporting form. And if you're one of our insureds, that traditionally comes to my claims team, and we report that to the carrier for you. There are some additional state reporting requirements once you have that form. If somebody's going to be off for greater than 7 days, if they have a specific loss, meaning some sort of amputation or an injury that is going to leave them partially or fully disabled. And then obviously there's certain requirements if there's a fatality as well. And there's also some reporting that is required with MyOSHA or OSHA. So being able to get that form promptly helps us sort of direct all of those conversations with who needs to be contacted. So these are some important numbers in Michigan. When we're talking about a medical only claim, this means they're only going to seek medical treatment. We expect them to be returning either the same day or the next day. We're not expecting any extended time off of work. There's no waiting period for medical benefits. As soon as an injury or illness is brought to your attention, they begin being covered under the work comp policy, unless it's a disputed claim, which we won't get into right now. The most important part about medical treatment in Michigan is that you have the right to direct care for the first 28 days. This means that we want to act on that. We want to be prepared with maybe an occupational health facility or physician in the area where we can send employees, all employees, so that we have some sort of consistency with medical treatment post-accident. This really helps kind of avoid maybe like family medical doctors or going to see some sort of like chiropractor or physical therapist rather than getting like the proper documentation on work restrictions and being able to return to work. Michigan does participate in a work comp fee schedule, meaning if you send an employer to get medical treatment and think, I'm just going to pay this bill, what work comp would pay for that bill is actually greatly reduced. So the impact long-term would be very small. For wage loss in Michigan, the important numbers here are 7 days. So there's a 7-day waiting period for wage loss. So if the employee comes back on day 5, we don't owe them any of that time off. On day 8, wages begin to be owed. From day 8 to 14, they are owed wages. On day 15, we pay back to the day that they left work, so the day of disability. If the employee, 14-day calendar days. So this counts weekends and holidays. This is not work days or whatever their particular schedule is. It is calendar days. And the benefit rate is traditionally 80% of the injured employee's after-tax average weekly wage. And this is subject to a maximum rate that is calculated annually. Wage loss benefits are calculated by taking the average of the highest 39 weeks of the prior 52 weeks. If you have a newer employee or somebody who hasn't worked there for a year, and then we have to kind of calculate that just a little bit different, with a little bit of projection in there. So work comp claims that have an injured employee that returns to work within 7 calendar days are deemed medical only claim. They receive a 70% reduction on your experience mod. Your experience mod is kind of how we compare people in your industry to each other. And if you have a good experience mod, your insurance rates are lower. So having medical only claims is really a benefit to you, to the employee, to sort of everyone involved. Work comp claims that have an injured employee that does not return to work within 7 calendar days are deemed indemnity claims. They do not receive that medical only discount. Once we've paid indemnity, that claim doesn't have that discount, we can't get it back. Another thing to note here is sometimes even an employee may return to work within that 7 days, but if they have a specific loss, it will be considered an indemnity claim. The most recent example of this is somebody losing the tip of their finger. Often they can kind of just come right back. It gets stitched up, bandaged, they're back to work, but it's still an indemnity claim because it is a specific loss. It's considered an amputation. An employee who is offered light duty work within their restrictions and refuses the work, they're subject to receiving a wage dispute from the work comp carrier. This means the employee will not get paid until they accept the position or provide updated restrictions for the reasons they can't perform the job that was offered to them. This is why a return to work or light duty program is so important. Often, we don't have any sort of requirements where they have to work that exact job. We can offer them light duty work at the same employer to get them back to work. There's so many benefits to getting people back to light duty work. It keeps their schedule. They get to interact with all of their coworkers still. They're back. They're still doing some type of job. And this prevents sort of that sitting on the couch, getting kind of other ideas in your head type situation. So we really want to encourage people getting back to work as quickly and safely as possible. If an employer has a light duty position that offers less compensation or fewer hours, you can still offer that to the injured worker. And then there would be sort of a work comp offset where they would make sure to calculate the average weekly wage, what hours and pay the employee is getting, and then the work comp would pay a portion of it while you pay a portion of it. That is still considered an indemnity claim since wage loss is being paid on the work comp claim. And so it's still a good opportunity to get people to continue to work and kind of offset that cost, but it's not always ideal. So in understanding restrictions, so the quicker you're able to get the claim reported, the faster we're able to sort of help you with a return to work program and get people back to work. The longer an employee is off work on work comp, the harder it is to get them back into that position. The longer they're off of work and the harder it is to get them back, the more likely you are to have a work comp settlement, which can be really costly. So we want to get employees back to work quickly. It's a benefit to you, it's a benefit to them. Insurance carriers are really happy about it. So early involvement in treatment, understanding restrictions, this can all help bring down the cost of claims. We always encourage people, request those doctor's notes, ask for the restrictions, understand the injury, where are they treating? Is that the right physician to be treating them? Do we need a specialist? Really look into what the injury is and how we can get them back to work.
So Cameron, in having a conversation with an employee, right? Because oftentimes HR folks and safety folks are not the same person at an organization, right? So you might have a safety individual that directs people to care, and the HR person has no knowledge of it, maybe for several days, and then they have to make quick work of that conversation. How does that usually go best with an employee when the HR manager has to come to them to talk about return to work program?
Yeah, I would say the best thing to do is just, like I said, have a conversation and be able to understand where did they treat, what is the injury, how are they feeling, and then getting them to understand, hey, we want to make sure that you can be here working safely. We want to make sure that you can maintain your pay. We don't want to have to, put you on work comp and you're getting wage loss and you're only getting a portion of that pay. We want you back. We want you working. We want to make sure you're doing it safely. So again, just making sure that was that physician that they initially saw, was that appropriate? Are they getting the care that they need? Do they have any follow-up appointments? And kind of just stepping in at that point and getting all the really good details that hopefully safety people are getting, but gotta train them.
Any other things to add on that from the HR team? No?
I'm a big fan of working really closely with my friends in safety to make sure that that person doesn't leave without HR kind of knowing about what's happening so that we can follow up, because I've seen it gone south. Sometimes that communication, if that's not part of the process, maybe time to revisit that process to make sure that everybody who needs to know is made aware of the situation before we get into that position as well.
Right.
And I would say that get a really good relationship with your work comp medical carrier. I can't obviously advocate any in particular, but we had one in town and, we got continuity of care. They had the same people there all the time. They had care after hours, which was important because we were a 3-shift operation. The doctors would literally call me after any employee was seen to tell me what they saw and what restrictions they'd given the employee, in addition to the piece of paper, of course, that you get brought. And it was very helpful. We could give them insights if there was a claim that, I know these never happened to you, but if it was questionable, we could tell the doctor about that and they could kind of, okay, thank you, I'll keep that in mind when I talk to them. And so getting a really good medical carrier is really critical to getting people back to work.
Yeah, and start thinking about it now. Like you said, it's sometimes during the day, it's easy to find some place that is open and has a physician available, but start thinking about those off hours, weekend type shifts, and having a relationship with that physician, even if it's, somebody's going to go to that urgent care or occupational health facility, even calling ahead and just making like, oh, we have an employee that's coming in, here's our work comp information. It can be as innocent as that, but just making sure they understand, who is the contact for this? Who should we be sending the paperwork? Because sometimes an employee will go and the physician doesn't know who to give the paperwork to, so they just send it with the employee. And some employees are really good about handing it to you.
We don't understand the implication. All right, wonderful. A couple of questions on this before we go on to Cobra. Yeah,
With a 3-shift operation, sometimes modified duty is not always available on 3rd shift. Would it be considered a refusal of modified duty work if that's available on 2nd or 1st? And it does change their schedule.
yeah. So the question for the virtual folks is, if you're on a 3rd shift situation, would moving, and there's no light duty work on 3rd shift, would moving them to 1st shift or 2nd shift, would that be allowed?
It's certainly a good idea to offer it, right? If we have available work off shift, whether or not we could dispute wages, if it's going to alter their job that significantly, would be questionable. I think it would specifically depend on how long it's going to be. Can we ask them to do it for, 14 days? That's kind of inconvenient, right? But if it's going to be this longer period of time where we know these restrictions are going to be maybe 12, 14, 16 weeks, that's a reasonable situation to say, hey, we have this opportunity on another shift, and you can change your sort of life and schedule for an extended period of time. So I think it's how long do we expect them to be out, and what can we ask? What is a reasonable accommodation at that point?
Does that answer your question? Okay. All right, let's move on now. Let's pass the clicker on to Lisa. So Lisa, when FMLA runs out, we have to look at Cobra, but you're going to be talking more about Cobra
Yes.
in general as well.
We're getting enough of the alphabet soup of acronyms here in the land of HR. So for those of you that aren't familiar with this requirement, it's called the Consolidated Omnibus Budget Reconciliation Act, and I'm really grateful for acronyms because that's a mouthful. So this was enacted many, many years ago, and really is a vehicle by which covered employees are able to continue on their healthcare benefits upon certain circumstances when they lose coverage. It is generally, for most cases, it's about 18 months. However, sometimes when there's a disability, it can go to 29 months. And in certain circumstances, and this doesn't happen very often, at least in my experience, it can go on for even 36 months. So basically what happens under the provisions of Cobra is that the employer stops paying the employer's portion of premium, and the employee can elect to continue on that coverage by covering the entirety of that premium plus a 2% administration fee, which we'll talk about here in a couple of slides. So what are those other certain circumstances by which you might be eligible for Cobra, to elect Cobra continuation coverage? Whether you have a voluntary or involuntary job loss, so whether you resign or you're let go by the organization, a reduction in hours, so you take someone from full-time to part-time, not under FMLA. That's where these things get a little sticky wicket. So if they're covered under FMLA, you've got to continue on their healthcare coverage, which we'll talk about a little bit later. If there's a death in the family or a divorce or legal separation as well. Oh, one thing I did want to say about that too. We're going to talk just today about federal Cobra. Certain states, not Michigan, but certain states also have mini Cobra laws. So if you have facilities, operations, and other states, it's just good to be aware of what those state regulatory requirements are. And so, we can answer questions about that afterward, or you can seek legal counsel, or, if you've got questions on what mini Cobra laws might be for other states. Let's talk a little bit about Cobra eligibility next. So to be considered a qualified beneficiary, therefore someone eligible to elect Cobra, you have to number one, be covered by the health plan the day before the qualifying event. Talk about qualifying event, what those are in just a moment. Rule number 2 is the qualifying event must result in a loss of coverage. Okay, so you gotta be covered by the health plan, and that health plan is no longer available to you. So again, this is gonna be things like employees who voluntarily or involuntarily terminate for any reason other than gross misconduct. We can talk about that as well. Falling below the minimum hours required by the plan. A lot of plans have that 30-hour threshold, especially if you're above 50 employees, if you're a small group, that 30-hour threshold doesn't necessarily exist. So you may have somebody who goes from, again, full-time to part-time, who therefore may be eligible for Cobra because they now experience that qualifying event or loss in coverage. Death of a covered employee ceasing to be a dependent. So I'm no longer 26. I flipped the calendar to I'm 27 years old. I'm no longer under mom and dad's plan. I get a Cobra notification from my mom and dad's plan if I was previously covered under them. Or if a covered employee becomes Medicare eligible. Some of these, and the ones with the star asterisks on the slide there, are eligible for additional 18 months of coverage. So that's where that 36-month threshold kind of comes in. I want to talk a little bit about, I think we talked about the who. Let's talk a little bit more about the who. So again, this is employees covered by the health plan. If they have not ever participated in the health plan, they've waived, they've opted out, they've been on their spouse's plan, they're not really experiencing that loss in coverage, right? They weren't ever eligible, or they may have been eligible for the plan, but if they waive their participation in the plan, there's no loss of coverage. So rule number 2 kind of rules them out. Excuse me. Each qualified beneficiary can also make their own independent claim, if you will, or their own independent election, if you will. So for example, if I'm going to cover me, I'm covered by the group health plan, it's myself, it's my spouse, and our adult child who's 23 and off at college, right? We each get to make an independent election because we're each experiencing that loss of coverage, and we're each able to make an election under the terms of Cobra. So that means we could choose different plans, in fact. So it's a little unique. There are certain circumstances though in which they can't make generally folks will go through, they'll have the same plan that they did before. So this isn't a time to go from the HMO plan to the PPO plan, with the if it's open enrollment, or you're generally not adding additional people to the plan at that point either, unless you're having a baby or there's some other qualified life event that would open it up to additional people that would have otherwise been covered under the plan. So that gets very, very detailed and nuanced. I'm going to try to keep it at the 101 level here today. So if you have specific questions, we can answer those after the fact. But just keep in mind that mere eligibility for the plan isn't on its own sufficient to be considered a qualified beneficiary. Okay, so you got to actually be enrolled in the plan to be covered by Cobra. So as I alluded to earlier, the good news for Cobra is that we as employers aren't responsible for the employer's portion of that premium, right? That entire burden then shifts to that employee or former employee in many cases to cover 100% of that premium. So their portion and your portion of the premium. Plus, Cobra regulations permit you to charge a 2% assessment on top of that for the administrative burden. Sometimes that if you outsource your Cobra, that premium kind of covers, that helps you to cover that cost there. There are certain times when you can charge more than 102%. I've never actually seen this in practice. You maybe have. But in certain cases of disability, you can actually charge more if there's a continuation due to a really severe disability. Again, it's pretty rare that kind of thing would happen. And the payment for this is due within 45 days of that employee making that election. We'll kind of go through some timelines as we talk about that as well. A lot of times people are just writing a check after tax. They're just writing a check in and things like that. Sometimes we do have employers that say, you know what, I'm going to give this employee, I'm going to pay for that employee's coverage because we're going to offer, we're eliminating their position and we're going to offer them a separation agreement and a severance package. And I want to cover Cobra for their family. They've worked here for a lot of years. We're just doing a downsizing. I want to take care of those people. We see that fairly commonly as well too. My advice to you is get it in writing, have it be a part of that agreement, make sure that they actually go through the process of electing Cobra coverage, put a little bit of that burden on those employees before you just continue to pay that premium. Because next thing you know, all of a sudden they're on your plan for a long time, and that's not what anybody wants. It's good to have those dates and have the documentation fully in order there. All right, so what's covered under the terms of Cobra? More times than not, it's really the health plan. That's really what people want to continue on with. Dental, vision, those are also covered plans. You could even do flex spending accounts if you're offering those. I don't see that very often. There's not a real good way to do, the benefit of having a flex spending account is that pre-tax payroll deduction. So they're not getting payroll. It's kind of hard to get the pre-tax benefit of it, but it is covered under Cobra. An EAP, if medical care is part of that, can also be a covered plan. Life and disability plans, not covered, not considered a medical plan under terms of Cobra here. HSA plans are pretty unique. An employee on leave may continue to contribute to their HSA, provided that The health plan coverage continues during leave, but there's some squirrely things there, so we can talk about that offline. And again, you're not generally switching plans or adding a bunch of dependents that were not covered on the plan unless there's a specific qualifying event at that point, or it's open enrollment. Or for example, I've seen this a couple of times as well. I have Priority Health and I am moving to Florida. And we know that Priority Health is a local provider here and doesn't really have the network in some of the outlying communities, or even sometimes in Lansing, there's a little bit of a hole there, So if I'm moving outside the area and there's not a network where I'm at, so that may open up the ability for me to go from one plan to another plan if the network looks a little bit different. Again, it doesn't happen that often, but something to be aware of as well. Okay. More paperwork. Who's excited about more paperwork? My biggest advice to you is partner with somebody to take care of this tape for you, because there is much like FMLA. I almost think FMLA is easier to deal with than Cobra Administration because of the timelines. Employers can find themselves sideways really quickly when it comes to the timeliness. I mean, it is literally must be sent on this date, or we are at risk as the employer, and that's just risk we don't need to deal with. And it's really pretty affordable to partner with a number of agencies. And I'm not going to recommend any, but there's a whole bunch of them, and we can share with you some of the great ones in town here that do a great job of helping you to take care of this administrative burden of FMLA notice requirements. So the biggest thing is you're going to want to make sure that this is in your summary plan description or your benefit guide. Make sure you've got some general language in there about what the terms and conditions of Cobra notifications are. Every employee that comes on to the group health plan has to get a general notice to say, if you're ever to lose coverage, here's kind of how it works. Here's what you can expect. The burden of proof is, you've got to make sure that you report to us that you've had a Cobra qualifying event so that we can pull the right triggers at the right time. That has to be distributed to your employees within 90 days of their enrollment in your health plan. Again, sometimes people just put it right in their benefit guide as well. The election notice is the really important one as well. So this happens when there's actually, there's a qualifying event that has happened. So you've got to put those employees on notice and give them the opportunity to elect Cobra. It's going to say things like, here's the plan that you've currently elected. You're in the Blue Cross, HMO plan, and it's the family covered plan, and it's the gold one, and it costs this amount of dollars per month. And it usually is that 100% plus that 2% fee. So they know exactly what it's going to cost them. And it gives them those timelines to say, if you don't elect by this date, you're no longer going to be eligible to purchase at your own expense this Cobra continuation coverage. Unavailability of coverage, like if the plan is terminating, and then early termination of coverage. If, for example, if an employee doesn't pay their premiums, again, we talked about earlier, they've got that 45 days in which to make their first premium payment, but it gets today, and there's a little bit of a grace period, which we'll talk about, but if they aren't paying that, we've got to give them a termination notice, and then before we term them off the plan to let them know, hey, you didn't pay your premium, this is going to go goodbye if we don't receive your money. For example. The great news is Department of Labor does get us some model notices in this regard as well. So you don't have to recreate the wheel, but again, my recommendation is work with an outsourced provider. They'll make your life a lot easier because otherwise you're going to live and die by your calendar. And okay, it's the 14th day, it's the 45th day, it's the 60th day. And if you've got a large population of employees, it's going to be an administrative burden, if you will. Okay. Speaking of burdens, there are some financial implications for non-compliance. $100 per day tax penalty. ERISA also gives us some stuff. I've even seen some stories where we are on the hook then for medical expenses incurred by that employee if they weren't offered time. So this can get really expensive really quickly. So it's just important to make sure that you understand you're giving everything out. And the good news is, again, it doesn't cost you really anything because the employee is paying for it. So I'm not going to spend a lot of time about this, but as you know, the American Rescue Plan, which was signed in by the current president back in March, allows for a Cobra premium subsidy. We got 30 days left on that guy. I'm not sure if it's going to be extended or not. I can't look into my crystal ball. I haven't talked to Biden lately, so he hasn't told me what the plans are. But really what this is saying is that the government will allow you, will cover 100% of Cobra premiums through September 30th. So in certain circumstances, we'll talk a little bit about those. Really the premium, in that case, the employer pays the premium and then can file for reimbursement on their 941, their quarterly tax return, to get that reimbursed from them. So I don't know if that's happening a ton so much, but certainly it's a really attractive thing. I think there's probably some employees who probably weren't going to take Cobra and then saw that come through and thought, oh, what the heck, why not? If Uncle Sam's going to pick up the tab, I might as well get that extra level of coverage, because it doesn't cost them anything right now. Okay. So there are, to qualify for this has to be, to qualify for the subsidy under ARPA, to have the government pick up the tab, it has to be involuntary separation. So what is involuntary? And there's a couple different standards here for what involuntary is, because they talk about for cause and they talk about gross misconduct. For cause and gross misconduct are very, very different things. For cause generally means like, I guess more ordinary misconduct. I didn't meet my sales numbers. I'm a poor performer. I have a bad attitude. You know, all those things that you all say about me all the time. However, gross misconduct, that's a whole different level. Like that's fraud, that's theft, things like that. Okay, assault, yeah, things like we're like, okay, that's not just some guy being a jerk in a lunchroom. Like this is, well, maybe it's a real big jerk in a lunchroom. So the employer here has to independently, unilaterally exercise its authority to terminate when the employee was able and willing to continue working, but we said, but the employee did not either resign or we took an adverse action. So like maybe we reduced their hours that made them go, okay, I'm out. Okay. And they didn't want to return from furlough. So employees can lose that subsidy under a couple of different ways. One, they become eligible for other group healthcare coverage, including Medicare. They exhaust their Cobra continuation window. So they've gotten to that 18 months or 29 months or 36 months, or it turns September 30th and the government decides they're not going to continue on with that subsidy program. Again, it'll be very interesting to see what really happens there. So let's talk a little bit about timelines. And then that's going to wrap it up for me. So employees have to notify you as soon as possible. I would put something in your handbook if it's not there already. You know, have 30 days to notify us of a change in status, a birth address change, divorce, baby, all those things that you typically will have that language in your handbook. They've got to make sure that they tell us that they're gonna have a change. From there, we've got 30 days to notify, for example, our Cobra Administrator, if you're working with an outsourced provider, Infosource or Basic or fill in blank, there's a million of them out there. We've got 30 days to notify them. They in turn have 14 days to mail out that Cobra notification. If we don't have that, we as employers, that burden to mail out that election notice falls on us as the employers, okay? After that, the plan, one thing to note about that, has to go to each of those qualified beneficiaries. So if you've got a covered dependent that's away at college, we've got to get their address and make sure they get one of those notices. If they're no longer, their mailing address has changed, they're not receiving mail at home with mom and dad anymore, we've got to make sure that we get that notice to them. Same thing if there's like a legal separation, you and your spouse aren't living together anymore, got to make sure it gets to that separated spouse who maybe isn't living within the same household. So it's really, really important that we make sure that we get all of that information and we send each qualified beneficiary their election notice. Because again, they can each make their own independent election if they are a qualified beneficiary. So interestingly, again, we talked about they have 45 days then to make their election. When they make their election, it can actually go back to the original date of cover, the day that they lost coverage. So some employees will wait to day 59 at 11:59 p.m. in which to make that election. In fact, it's not a bad strategy if you've ever found yourself in that spot. You might not need that Cobra coverage, but knowing that it's available to you for that 60-day window can be provide you with some peace of mind. So just keep in mind, though, it is backdated, and then that employee then will owe those previous 2 months worth of premiums. So they got to backdate those premiums. They got to pay the full bucket as well. So it's really interesting. I mean, you add all that up, it's 149 days in which somebody has to make their initial Cobra premium payment. And then they've got to pay on a regular schedule. It's usually, the 30-day mark each month thereafter. And if they stop paying, then we obviously have to go through that. There's a grace period before terminating coverage, and we send them an early termination notice so that they know, hey, if we don't get your payment by this date, sayonara to the coverage. I think that's all I want to say on that one. That is the world of Cobra. It's exciting, isn't it? Question?
I think you had mentioned that different people can select different plans at the time that Cobra happens. If there's a medical support from front of the court, could an employee elect to say, I don't want coverage, but I need this to continue for my dependent?
I believe
Yes, they
so.
can.
Yeah, I believe so.
Yes, they can do that.
Okay.
Yep.
So, if we have a former employee who's covered under the unit currently, so we're covering that Cobra cost for them, and then let's say on September 30th that changes, is that something we as the employer will be responsible for letting them know that, hey, you have to pay those premiums, or do we know what that looks like yet?
So the question is, what do we need to notify our employees when that subsidy goes away? I haven't seen anything on that specifically. I would think so. I mean, because they're going to lose that subsidy. It just out of the kindness of your heart, if nothing else. I mean, I would want to know if my subsidy is going to go away. I haven't seen anything come out. Is anybody else?
Are you're on a priority health plan, right?
Mhm.
I think, okay, so in Finish ISOL is going to be your default Cobra Administrator, and they have not released anything stating how they're going to handle that. But because you work with that vendor through priority health, they will be the one to address that.
Got it.
Yeah.
And that's another really good reason why you should align yourself with the right partner. Like, you don't have to worry about all that stuff as much. I mean, it's good for you to understand the world of Cobra, but all the nuancy details, again, your Cobra Administrator makes a lot of that headache go away.
All right, let's talk to Connie now. So Connie, it doesn't always happen that HR manager, director will know if someone is going to be going off on FMLA leave. Maybe a supervisor just didn't notify them, or they didn't know what to look for. And honestly, that's a lot for somebody to understand. So today you're going to be addressing how we can train our supervisors to give information to us so that we can make decisions on how to track that and be compliant.
I've trained a lot of supervisors as a consultant and as an HR person, and I'm going to tell you it's absolutely necessary that your supervisors get training. I know they love training about as much as they love overtime, but this is something that's really important. And the real key, you need to start just with basics. Don't overwhelm them with more than 3 consecutive days and 2 appointments with a doctor or an appointment and a regimen. Their eyes will roll in the back of their head and you will have lost them from the minute that starts. So just start them with some basics. Number 1, which employees qualify? They've got to be with us a year, including any time as a temp. That includes that. Have they worked 1,250 hours in the last year? Break that down. Do they work 24 hours or more on average a week? So part-timers are included in this. It's 12 weeks of leave and 12 months. You don't have to get how do you count your 12 months and all that craziness. Just 12 weeks and 12 months. But really, really emphasize, it can be intermittent, which means it doesn't mean just having a baby, having a surgery. It can be taken in days, hours, minutes. And that's really important for them to understand, because that's going to be something they're going to have to grapple with as a supervisor. And I promise you that will go over like a lead balloon. That is the number one thing that people will get. I mean, I train, I would say nonprofit people with good hearts and good souls. And the minute I said that, I could feel the room just fall. So emphasize that it's unpaid though. So people, not everybody can afford to be off for 12 weeks if they're not going to get a paycheck. And that you need to outline what your company's policy is going to be in regards to that time off. Are you going to make them take their vacation in the PTO? Are you going to let them keep a week? Are you going to let them keep all of it? And why you pick that? Why your philosophy backs that policy? You need to talk about what medical conditions qualify for leave. I don't know that I would give you the 4 different categories because I think they get very bogged down. I would make it simpler. Chronic conditions. Things like diabetes and asthma and recurring back injuries. Not just that they, obviously babies, that also includes morning sickness. So if your pregnant employee calls in, that can be covered under FMLA. You know, things like my mother's in a nursing home and has Alzheimer's. It can't be cured, but it is a serious health condition. And it can be anything like I get the flu and it gets to be more than just a standard, I'm off 2 days and I'm back. What I basically tell people is what doesn't qualify, very little, depending on the circumstances. And so don't assume, oh, it's just, and so it doesn't qualify. There are a few things. If it's purely cosmetic surgery, that's not going to qualify. Is it cosmetic because they had an accident and that is a repair? That qualifies. So we have to say, don't assume, just don't assume. And then you might want to mention the military leaves, just very briefly, say, hey, there are some military conditions that qualify, but just forward them to me and we'll talk to that person about it. If they or their family member are called to active duty or injured in active duty, there are some leaves that they may be eligible for. And we're, you know, rather than bogging down with something that may not apply, especially, I don't know, in our area, we don't have bases, we don't have Air Force fields, you know, we don't have things that these requests are made very often.
One thing just on what medical conditions, one of the things that I think we're seeing a lot more of, and you probably are too in your day-to-day business, is people requesting leave for anxiety and depression and a lot of mental health things that you can't see with the naked eye. You know, they're not rolling in a wheelchair or on crutches or, you know, walking around with a sling. But those two can qualify as serious health conditions depending. You know, again, recurring course of treatment, you know, there's a lot of things that we can dig into in terms of the true actual legal definition of a serious health condition. But don't overlook that. You know, employees having a hard time showing up, they're missing shifts, they're calling in, things like that, and they qualify for a leave of absence on an intermittent basis. So just worth noting there. Sorry to interrupt.
No, you're totally fine, totally fine. The other thing, you want to mention what family members are covered. You know, it's children, spouses, and it has to be a legal spouse. Sorry if you've been with that person for 14 years, but if there's no marriage license, there's no coverage. In-laws are not, parents are covered, but in-laws are not, oh, sorry, honey, I can't go take care of your mom. You're going to have to take the leave. So these are things that you want to emphasize so they understand it isn't cousins and aunts. And now always emphasize that. I hate to bring up in local parentis because it's Latin, but it's really important. If grandma raised me, I can take time off for grandma, or grandma can take time off for me. If I raised my siblings, I can take time off because I was their parent in fact, even though I didn't give birth. Okay, so that's a real, I've had many cases of grandmothers where I've had to give time off for a grandmother that got ill. So keep that in mind. But why are supervisors so important? Because they are the people that are with the people all day long. I worked for a cleaning company. I never saw those employees. They came for orientation and I never saw them again. They never came to our building for anything. And so it's really important. Your supervisors are out in the field, even if they're just over a wall from you, they know a lot more about what's going on in those people's lives. And so they impact FMLA a lot more. Number one, whatever a supervisor does, the company has done. It's this little legal thing called agency. So if a supervisor's a jerk, the company's a jerk in the eyes of the law. Okay, so we need to make sure that supervisors understand it's not just me or my decision. I'm impacting the company. But here's for you who have supervisors who like to ask for forgiveness rather than permission. Explain to them they have a dog in this hunt because they are legally liable personally if they interfere with somebody's FMLA rights. And there have been supervisors, executives that have been personally sued because they have retaliated or they have not properly informed employees of their FMLA. So they need to understand this. This isn't just a nice HR thing we're doing. This impacts them personally. Tell them, above all, call HR, call whoever's handling the FMLA in your company if they suspect any medical situations, whoever that might be, the office manager, if you don't have an HR person. Don't try to handle this yourself. Respond to any time somebody mentions a medical situation. Go to HR, please, and talk to this person or make the appointment so that they can do that. I've seen supervisors that made assumptions and that became a problem later on. So make sure they know, go to HR. They're really important in the world of FMLA because FMLA is called job protected leave, and who protects the job more than the supervisor? When somebody's on leave, especially intermittent, and this is where it's really hairy, you have to keep them on the same pay, benefits, level of responsibility, shift, schedule, and location. The job has to be the same or substantially similar. So for professionals, it's same, because it's pretty hard to find a substantially similar role unless you have multiples of a role. So another part of protecting a job is not retaliating against people for taking leave. And that can take a lot of forms. For instance, you can't discipline people for taking FMLA time off. And I have seen performance reviews written where the manager referred to their FMLA leave, and I said, go back and rewrite, please. We can't even refer to it. It's not a performance issue. You can't discipline somebody for not meeting a goal when the FMLA impacted that. So if I'm a salesperson and I'm gone in the third quarter, you can't write me up for not meeting my third quarter sales goal. The biggest one we see in court cases, the negative remarks, the snide little comments about people who are lazy or taking advantage of the system, or, remarks to coworkers, remarks in, where you think the employee's not around. That has no place, absolutely no place among your supervisors, because that can be considered retaliation. You're creating an unfavorable work environment. Giving people the unpleasant work, the heavy work, the dirty work, the stuff nobody likes to do because you're mad at them for taking leave. Excluding them from training or important meetings. Targeting, please God, never targeted them for layoffs. Okay, if you're laying off the whole line and they happen to be on that line, that is perfectly legal. But if you're saying, oh, they're gone anyway, let's put them on layoff. Absolutely not. You can't deny them raises. You can't deny them promotions. And this is important where raises are concerned. If somebody's off on leave and their raise is due, particularly if you're in a place where you have step raises, that's so many months you get a raise or so many years, give that raise on the day it's due, even if they're not there. Will they experience the actual financial benefit of that? No, but they will. But the raise will be given at the proper time. If you work in a place where you like to give the review before you hand out the raise, make sure the raise, they come back, you give the review, and the raise goes retroactive to the appropriate date. Because if you're pushing out the date, that date gets pushed out forever, and they've suffered a harm as a result of being on leave. So make sure you really watch when if you have people, like a lot of offices will do, or professional areas will do. We do reviews in January, and then somebody's off in January. Make sure that you don't miss that person. Put it in your calendar for when they're supposed to come back, but that review has to go out. Now, early in the world of FMLA, you couldn't deny perfect attendance bonuses to people on FMLA, which was a little bit hard for their coworkers to swallow. And a lot of managers to swallow. You can deny perfect attendance bonuses, performance bonuses, and other bonuses, but only if you deny them to people who are on unpaid leave for other reasons, work comp, personal leave, etc. If you don't do that, then you can't do it for FMLA. The clue is do not treat FMLA people any differently. Now, how does a manager protect you and protect themselves? Anytime someone says, I'm having some issues with my mom who's having some health stuff, my kid's been having asthma attacks, I'm going to be missing some time, send them to HR. They don't need to use the words leave of absence, FMLA, or any letter in any order, okay? They just need to say, I'm going to be needing time off, I'm going to be missing time, or I've been absent a lot lately, and this is why.
And if I could just jump in there, I like to start that timer, start that 12-month, 480-hour clock as soon as possible, because all of a sudden, a day here, a day there, a week here, a week there, all of a sudden you realize, man, they've taken 4 weeks of unpaid or paid leave, and now I'm going to start the timer. Well, you just gave them a lot more time than you legally had to, and especially that's a critical position. You need that person actively at work. So it's good to know early and start that timer as soon as possible.
So I will tell you, when I ran into it a lot, I was the lucky person I got to give all the attendance warning stuff. And many, many times they would be like, I've been absent a lot, but my kid, he's got this thing going. We've been to the doctor like 5 times. Okay, time to stop the attendance warning conversation and time to start the FMLA conversation. For your supervisors, that means, okay, let's end this right now and let's go talk to HR about this to see if it's an FMLA covered situation. The other time you might run into is a performance review, same idea. do you have an absentee call-in line, or do you have a person that handles absentee call-ins? If a person's called in 3-4 couple days in a row, it's maybe time to look into, is this potentially an FMLA situation? If somebody calls in, you notice for the same thing over and over again, maybe it's time to have a talk with them. And I say, I know you think, well, geez, don't they have any responsibility to come talk about? You know what, the courts really don't think so. They put a lot on employers' backs about this. They say that if you have hints that somebody might have a medical condition, you are on notice. They don't have to say, I need medical leave. They don't have to say, I have cancer. They just have to say that I've got a medical situation, or my mom is sick, or my kid is sick. And that should be enough for you to make some decisions. Now, if they just call in and say I'm sick, that's a whole different matter. But when they give you details, or you are sensing there's a pattern coming, you really need to sit down and have a chat with employees. And who does that the most? Supervisors. Another thing that supervisors really need to watch out is confidentiality. We do not discuss FMLA conditions with anybody but HR and the employee. And to be honest, I never told supervisors why people were off for FMLA. Obviously, when somebody's pregnant, it's pretty obvious. But other things I really didn't. I would say they're going to be off for their mother, or their father, or their child. And this is the term. They'll be off for 6 weeks. They might be off a day a week. And if they call in, I tell them they have to call in and say it's for my FMLA. They can't just make you assume. Okay, but definitely keep it confidential. Store anything medical separate from personnel files, please, so that it doesn't even give the appearance that it impacts their personnel records. And as I said, don't treat anybody in FMLA different than anybody else. They're just like any other employee. So it's super important that we do that. And supervisors are your key. So they really need to learn this stuff. It isn't just nice to know, it's need to know.
Wonderful. Okay, situations that everybody's next to, right? It's always going to be different because it involves employees. Okay, I'm going to actually just start with a couple of the ones that came in that I might be the ones to hear. So the first one is, what light duty options are there? Now, Kimber, it's in reference to work comp. So bringing someone back to work, make sure that that doesn't go into an indemnity claim. How can we bring people back on light duty work? What if we have a place that does not have options for light duty? What other options are there?
Yeah, so light duty work can be challenging, especially if maybe it's a sit-down position or they can't use their dominant hand and things like that. So if it's going to be something that's going to extend for a long period of time, we often recommend some type of local nonprofit where they could maybe go and do some work, maybe even a volunteer position where we are paying them, but they're still active. So we have to remember the first part is the financial part, right? But the second part is the people part, the human, getting them in their routine, out working, still continuing that normal work schedule. So if we really don't have anything in-house, and this is going to be something that is going to be, 6+ weeks, then we have some other opportunities in the community that we can tap into.
I know that the OVD team really tries to set people up with those relationships. So if you guys have questions on that, anyone on the OVD team is happy to help with that. The next question is, can't we just keep people on the plan and skip all the paperwork? No. As a broker, I would tell you that's a huge liability for you. So the reason why is because let's just say that you leave someone on the plan because they're just such a great employee and they didn't mean for this to happen and nobody really intended for it, right? They're suffering. Why would we hurt them in this way? Well, because if they have a claim in the ICU and they are not an active employee covered on your health contract, guess where that ICU bill is going to fall? Right in your lap. So we've seen it where contracts are reviewed and an employee is deemed as not active. The insurance company is not responsible for that claim anymore. So if you have not had, referred to as like the government program behind that protection of coverage for them, there is no protection of coverage for them. And that becomes a self-funded claim out of your pocket. So no, don't skip the paperwork. Another 2 questions that came in through the chat feature. Pretty specific. If a machinist goes on FMLA And it is considered an equivalent, no, I'm sorry, is it considered an equivalent position if they are returned to the same type of machine following the leave, but not the exact same one as before taking the leave?
If they have the proper training on that machine and are capable with the skills and abilities that they have to work on that machine, that is equivalent.
Okay. Is it okay to say we will not allow employees to return from FMLA if they still have any restrictions at all? Or we really can't say that because we should consider ADA qualifying things. How do we draw the line there?
So can you repeat that question?
Is it okay to say we will not allow employees to return from FMLA if they have any restrictions at all? Let's start with that.
That depends on how you, first of all, I would not advise that because you want people back to work. But if you can accommodate, I mean, obviously if they can only work with without their dominant hand and that's the only work you have, that's not accommodation you need to make. But there is an ADA situation because they could have a disability as under the ADA. And so under the ADA, you have a responsibility to discuss what accommodations you can make. So just having this blanket, we don't do it policy is not a good idea. The other reason it's not a good idea is I will bet that in other situations, you have allowed people to come back. Hey, so-and-so slid into home base and wrecked up his knee this weekend. We're gonna put him on that sitting position for a couple of days till his knee gets better. Or she's pregnant, we won't make her lift those 40-pound boxes anymore. If you're making those for other people in other situations, you have already created a precedent that you accommodate. Now, again, it has to be something that's reasonable. You don't have to create a job for them or give them a special job. But if there's legitimate work they can do, if it's, they can't lift 50 pounds and that's only a tiny, tiny part of their job, I would definitely work to accommodate.
Those are the questions that we received. So now we're back into the slide deck that you have in front of you. So here are some common questions. So I asked the panelists, I said, what is the most common questions that you receive regarding the topics that you're speaking on? And here's some of the ones that came up. So how do I know if we're no longer an FMLA employer? So we lost our eligibility as an employer.
So, if you do not have 50 employees in the current year or in the preceding year within a 20 or more work weeks. So once again, to remind, even if the employee is not getting paid, if they're active in your payroll system, your HRIS, if they're on a paid or unpaid leave, that is considered somebody that you need to count. People that we're not counting are going to be volunteers, right? Because they're not on your payroll system, so don't have to worry about that. Employees who's ended the relationship, so now they've been laid off, they're terminated, quit, whatever that might be. Or if they're working at a firm station outside of the US, you do not have to count those folks. But if you have 50 active employees this year, previous year, for those 20 weeks, you are still an FMLA employer. Can I force an employee to use their PTO, vacation, personal sick time? Absolutely. You'll want this to have noted in your FMLA policy that'll land in your handbook. And then depending on the strategy that you want to use, you can say, yep, I want my employees to exhaust all of their time off. Some employers will say, okay, maybe let's take all but 1 week, assuming that, they want to have some paid time off when they get back from leave. It's completely up to you guys as employers, which route you want to go. You just have to come up with a policy and be consistent and follow it. Can an employer ask for a second or a third opinion? This goes back to that certification form that I was referencing earlier. So you don't believe that the employee is really ill, right? Maybe you've heard through the grapevine that the person that filled out the cert forms is a friend. So the doctor is a friend of the employee. You can ask for a second or third opinion. It gets a little murky and know that the cost is on you as the employer to send that employee to what would be deemed a third party to kind of review the medical certification.
And it can't be a doctor you work with as the employer. So it can't be your Rock Health people or a doctor you personally know.
Yeah.
And I think that the question that just came in from Shauna is asking about how do you handle somebody that's abusing FMLA intermittently, asking for that recertification, right? But is there anything else you recommend?
It's really tough to address it, because if you have a certification from a doctor saying for the next 6 months, they may call in any given day because they have migraines or they have anxiety, they're going to appointments. As long as that employee calls in and says, hey, this is part of my FMLA leave, we already have that certification on file through whatever date. So our hands are tied for that time frame. So we really can't do much if we think the employee is abusing it.
I do think that there's sometimes we have the ability to go back and, because doctors are not always very clear. They're not clinically trained to fill out FMLA paperwork. They're clinically trained to read x-rays and give diagnosis and prescribe us medicine, right? So sometimes they say, may need time off as needed. Okay, that's not very helpful for me as the employer to know how to create, so sometimes you go back and you say, I need more clarity from doc. I need to know, is this every day, every week, once a month? Is it 6 hours at a time or 2 hours at a time? We got to try to get these docs to give us a little more information so that it's not just carte blanche. I can call in FMLA whenever the weather's nice. Hopefully that's not happening in organizations, but we know that there are unique individuals out there in the world who use this opportunity to their own benefit. So it's up to us to try to make sure that we've got real clarity and real consistency so that if they say, you get 5 days a month and they start using 8 days a month, we can start saying, hey, these aren't FMLA excused absences. That now falls under our attendance policy. We need to have a performance discussion about how you're violating that policy. So that's where, you try to get doc to give you a little bit more intel.
And what we would do, we will address your question. I can see you. You're allowed literally, if the doctor doesn't specify a time, to ask every month for a new note. No employer that is not insane will do that because it's just impossible to do that for every single intermittent case you're going to have. Not to mention it costs the employee a lot of money because doctors charge for these forms. But at a minimum, you should recertify every year. And what we would do is if somebody started going longer than the doctor said, hey, maybe a couple days a month and it's getting into 4 and 5 and 6, I would call the employee back in and say, you know what, we're really concerned because the doctor only thought you were going to be gone a couple days. This is going to start costing you on your attendance. And obviously whatever treatment he thought was going to work isn't working. So he really needs to know that. So here, take this form back to the doctor and let's get some clarification on how much time he really thinks you're going to be off. I would put it that way rather than I'm trying to catch you because I think you're using your FMLA. And doctors will generally appreciate that because they want to know. And there are the doctors who will sign anything because they don't want to hassle the patient. But there are true doctors. I've had a couple doctors say, absolutely not. They should not be off this much. I'm trying other treatments. So it's another way if they're exceeding significantly. Not the doctor gave me 2 days and he took 3, but if it's getting to be where they're taking a lot more, it's a good way to can it. I'm going to get to her first because she raised her hand first.
So I kind of have 2 questions. What about what you're talking about now and then the previous stuff about like return to work stuff? So like on the 380 form at the bottom, there's it says that there's return to work instructions, like there's a box that you can check. So I usually check that if depending on what the medical situation is, and then we have them go to Med 1. So I'm assuming that suffices, when they're off FMLA and they're coming back, depending on what their situation is, so that if there's no question about it, they can come back usually. So I'm just wondering if that's fine, as opposed to just saying you can just come back when the leave date ends. Does that make sense?
So are you saying that you require fitness for duty when they come back?
Right. Yeah, depending on what the situation is. So like when I fill out the designation notice, at the bottom it says return to requirements. Yes,
Yeah, it's a good idea.
Yes, and then it asks for like essential duties, and then I'll attach it, and then they know like, okay, you need to go to Med 1 before you come back. Yep. That's
Great.
how we usually handle that.
It's fine. Yep.
Okay.
It's not a bad practice.
And then for the like the abuse situation, what I have been getting into the habit of doing is towards the bottom of the FMLA form, there's a frequency that the doctors can fill out. So I have been actually asking them if they have an idea, put that, because a lot of people put like up to 2 times per month or 3 times per month, whatever the situation is. So then when I do my approvals, I won't put the medical reason in of what I'm approving them for, but then I'll put approximately up to 2 times a month or whatever, just because we have that situation where employees
habit of using it. Yeah, no, that's a perfect plan.
I don't think any doctor would approve Friday, Monday leave act. Is that right?
Yeah.
I don't think they're gonna specify Fridays and Mondays, they have to take off, surprise, surprise.
Just in the summer.
Yeah.
This is probably the big question that I get. Can I fire somebody on FMLA? You shouldn't, oh, I'm so sorry.
That's right.
You can finish her.
Yes, you can. You shouldn't live in fear if somebody's on FMLA. However, you want to make sure if it gets to that point, the reason you're ending that employment relationship has nothing to do with the reason they're taking FMLA. You know, you have an employee that goes on leave, you know, she just had her baby. We uncover her while doing her job that she's been embezzling money. Absolutely. That is a outright reason why we can terminate that employee. We'd already be calling the employment law attorney. Some of the murkier situations are, you know, oh, they haven't really been getting their work done because they're not here. Well, no kidding, they're not here because they're on intermittent leave. So we have to give them some grace there, and that's not a reason to terminate that employee.
It's not uncommon for us to have employees voluntarily separate from us and then 4 months later come back on board. I'm assuming that the 1 year requirement starts over again.
No, it does not.
So
The question was if somebody leaves us and they come back, does the 1 year requirement start over? The answer to that is no. You have to consider any time they've worked for you in the last 7 years. So the way you can head off an immediate request is if they haven't worked 1,250 hours in the last 12 months. If somebody's been gone from you for a year and they come back, yeah, they've got prior history that counts toward the 1 year, but they haven't worked 1,250 hours in the last 12 months. And you have to have both.
7 years.
So yeah,
The 1250 and the 1 year.
correct. Not one or the other.
So I have an employee who went off on leave for a surgery, and the doctor on the certification said she would be returned, or the certification said that she was on leave from like July 8th through August 22. So when I spoke to her, said according to this paperwork, we're expecting to be back August 23rd. I can't reach her. I can't. I've tried contacting her, calling her, leaving voicemails, email. I sent her a certified letter last week. Can we terminate her employment based on no contact? Because she hasn't updated us on her status about whether or not she still needs the leave.
It sounds like you've taken a lot. So the question, she's got an AWOL employee for those that are on the call. And it sounds like you've made a lot of reasonable efforts, including appropriate documentation. I definitely look at that. I mean, she could come out of the woodwork and say, well, I was in the hospital and, you know, I was on a ventilator and couldn't call back or something like that, which, okay, we'll deal with that at that time. But I would send a term letter, most likely certified as well. I think you're probably pretty safe there, given all the steps that you said you've gone through.
Yeah.
You know, that's not to say you won't get a suit. You know, we're never immune from somebody filing a claim against us, but I think your risk is probably relatively low. On that note, I'm not an attorney and I don't play one on TV, so I just like to put that out there. So you could check with your legal counsel, but if I was in your shoes, I'd probably feel pretty safe in doing so.
What about benefits?
Oh,
The producer.
my guess is, so most employers have in your policy, you know, there's usually, and we'll talk about this a little bit, there's usually a policy that says like, if you're gone for the 3 months, you know, that's kind of it. And they're not on ADA leave where you know, ADA doesn't really cover that anyway.
Even if her leave isn't the full 12 weeks, because it was only for like 6 for the surgery, the certification said she should return after 6 weeks.
And you made it clear in all the documentation that she should return?
Those
That's
are
it.
no call, no shows. My last
Yeah,
suggestion
I
on-
did.
from HR would be, did you try her emergency contact?
I did.
So you've definitely done your due diligence.
Yeah, I think so too.
So regarding the benefit question, so at that point, the date of termination would be the Cobra trigger.
Okay.
So you'd want to make sure
Yeah.
that whoever you're using, your Cobra administrator, would know that that date of termination then flips from FMLA leave. Has that person been paying their portion of the premiums all along?
No, we were gonna, well, she paid some of it, but then we were gonna take the rest of it out of her paycheck when she returned. We were gonna sort of like, work with her a little bit on that.
So it flips to Cobra then? Yeah.
Oh, yeah.
And-
Subsidies through the end of the month.
Right. Is your termination provision date of termination or end of the month?
date of termination.
Bingo.
Well, but ARPA through September.
Oh. So this is Bruce, and he's. I said Connie's never had a situation that I could stump her on. Bruce is one of those people that will always find the exception.
Yes.
Yeah, so for ARPA, right, so that coverage is gonna be, well, that
Well, wouldn't
begins
she be a
today,
voluntary term because she was a no-call, no-show?
Yes. We
right?
consider
So
that
which-
voluntary.
Yeah.
3 days, no call, no show consecutive is what I would do for them.
We got it, all right. The team, Andrew.
Connie, you had mentioned the idea of agency in the organization, and someone who lives on the periphery of HR, I just find this fascinating, but also frightening. What are, and I can't remember the gentleman's name now from Miller Johnson, but, we'd always say this is a class on how to like game the system or something like
Right.
that. But what are some steps, like at an organizational level, if you're thinking at that level, to take to protect themselves, educate the supervisor, staff, and then maybe on the insurance side too, an example that comes to mind is people that they have a catastrophic claim for workers' comp because they didn't have like a policy, set up, and so someone did something, they got hurt, and now they are almost uninsurable. So just, but more at an organizational level, what can companies do? I might be too big of a question, but to protect themselves when you think about the totality of the organization.
Andrew, thank you for giving me a softball on this one, because my answer is gonna be work with a trusted advisor. So not only is this team here, but we have a whole agency full of people that are going to direct you to the right resources. So really, honestly, you guys can't be expected to know everything, but sometimes you are expected to know everything. So make sure that you're working with someone that can help there. But any other input on that one?
No, I mean, I've been in HR for a long time, and I'm still learning every day, so to have a network in a village, and many of my village are audience members here, you get the right people on the backbone to help you navigate through some of this stuff. Because you can know all the things there is to know about FMLA and work comp and ADA and all this stuff, and still get some sticky wicket curveball that somebody throws and you go, yeah, that's really a complicated one. So use your network. I agree with you.
And I know people don't like calling attorneys because you hear the dollar signs changing in the background for every minute. But there are just some times that you are penny wise and pound foolish when you don't, because a typical lawsuit just to defend it and get to a settlement will probably cost you in the neighborhood of $30,000 to $60,000 to $100,000. I think it's much worth it to spend a little time up front, maybe a $600 employer bill, to have him draft that letter to that problem employer to guide you in how to handle that disability, particularly when disabilities are involved, people. When you go to a jury, they already hate you because you're the big company that picked on this poor sick person. You've got like a huge mountain to climb to win. So you definitely want to make sure that you do your homework up front. Pay the money up front to avoid paying way more money later. So be very, very careful. I don't go to an attorney for everything. I never did. But there's just certain things, if there's a sticky FMLA situation or a sticky ADA situation or a sticky work comp situation. I think you really, when it comes to medical, juries and judges are just naturally sympathetic. Yes, we would hope they would be. And so you need to make sure that you protect your company.
Emily, did you have a question? Oh, sorry.
I do. Oh, mine goes back to the layoffs during FMLA. So we lay off technicians for at least 3 weeks in December. What if I have someone that's on FMLA at that time? Because they don't get the unemployment then, but we usually lay off and they get unemployment for a few weeks. How does that work if someone's on FMLA during layoff?
You don't have to treat them the point is, don't treat them any differently. Treat them as if they were an active, on-job, every single day employee.
Okay.
So if you would lay off the technicians in December, that person also gets laid off in December. It's not going to be something they don't know is coming.
Right.
But it will mean they probably won't qualify because you have to be able and available to work. And obviously the able is probably not there. And so they're going to have to make some plans regarding that, or if you have a short-term disability policy, that might cover them. But definitely do not treat them any differently. I just don't think, oh, we got to lay off 10 people and they're already gone all the time anyway, so they're an easy one to cut. And I will tell you, I've heard such discussions in my presence. So please don't let people talk like that.
Right. They all get laid off. So
Right.
really, I'm wondering if they get to apply for unemployment while everybody's laid off.
They can try,
Okay.
and in the current atmosphere, they may get by because I think the employment system is extremely overwhelmed. But I don't know that they'll win. That's a pretty cut and dry one. Unless it's COVID. I'm gonna tell you it's probably not gonna go through.
All right, let's keep moving along. Quick, on this one, what if an employee doesn't get us the paperwork timely, and what if they just outright refuse to give us the paperwork?
Sure. So at the end of the day, if they've never gotten you the paperwork, then that entire time that they were supposedly waiting to be on FMLA is truly not protected. So you can go back to your attendance policy at that point and potentially take any sort of action. If it's just delayed, it's just delaying the fact that their job protection is getting delayed. So we can still go back and potentially reference our attendance policy and take an action.
I will tell you that pregnant women will not get you paperwork in 15 days. They'll hand it in at one appointment, and at their next monthly appointment, they'll bring it back. It's just a very common thing. As long as they're not taking any time off from morning sickness and the like, it's really no big deal. But so just, I know 15 days is 15 days, but just know in certain circumstances, such as that one in particular, you may not get it in 15 days. As long as they're not taking time off, no harm, no foul.
Are there any times where you can kind of go outside of the typical FMLA paperwork process? So you get like a doctor's note that person needs to be off for a week. Do we need to kind of initiate the paperwork process and make them go and get additional paperwork to comply and apply FMLA leave?
The question was, if we get a doctor's note that says they need to be off, do we need to do FMLA paperwork? I say yes. Number one, you want to make sure the condition truly qualifies as an FMLA condition. Likely it does, but you want to make sure it truly qualifies. Number two, the law says if you don't acknowledge it with the designation notice that says this is FMLA, you can't count it toward their FMLA down the road when they've taken more time off. So we want to make sure we start counting everything right away. And so, yes, I would definitely. Now, I will say there is one minor exception. If it's work comp, you have all the medical paperwork as the employer to make those determinations. And so if it's a work comp injury that qualifies and it is an employee who can't take FMLA because they've been there a year, you may not have to send it to their individual doctor for confirmation. But I would still go through the process of filling out forms that say this is work comp, especially, or FMLA, especially when there's a work comp injury. And a lot of people don't think about that. You definitely want to count concurrently if somebody's on FMLA and work comp, and they can count both ways. Not every work comp injury will qualify, but many times they do.
And sometimes employees are like,
the paperwork like after the date they need it. It's like I've gotten the same situation where like they need a week, but they've given me doctor's note halfway through the week or at the end of the week or something, like when they've already needed it.
Oh, you mean like they've already been off for a while and then they come and ask you for paperwork?
Yeah.
People aren't always going to know. If I'm sick for a couple of days, I don't know it's going to turn into 6. Or if I've been having stomach problems and calling in, I don't know it's whatever, a surgical matter. The law doesn't give you a lot of okay to go back retroactively,
Right,
which is an area to be very careful about. I will say everybody has their own rule, okay? I would go back a month, but that was with my attorney, was okay with that. I would go back for any absences. And specifically, if the doctor referenced them, they were seen on this date and they were gone that date. Okay, I can count that one for FMLA. But I would not go back months and months and months for sure. And again, I would definitely do it with your attorney and be consistent. Like if you're going to go back a month for one, you go back a month for all. You don't do it for this guy.
Retroactive.
Yeah, but then you aren't always going to know you have an FMLA situation until you're a couple of days or maybe a week in. Not everybody lands in the hospital. And so you have to have a little bit of grace where that's concerned. Obviously, you're going to have a baby. Unless you're on TLC, apparently, you're going to have a baby. And you're going to know you're going to have surgery. Nobody gets, unless it's an emergency, nobody gets surgery in a day, right? So there are some things that should definitely be foreseen.
Keep moving along. Oh, awesome. Yeah.
What about cases, and this happens quite frequently, anyway, somebody notifies us that they're in the hospital. you know, they've had a heart attack. How does that time frame work?
Send them the paperwork.
Yeah.
You know,
Send them.
we'd love to hear how long you're gonna be gone. You know, we're gonna send you flowers or a teddy bear, cookies, whatever we can, because we care about you as an employee first and foremost. But I'm also gonna send you some FMLA paperwork. Let's have Doc get that med cert back to us so we know how long we can expect you to be gone and when we can expect you to, you know, return to work. And if there's gonna be any work restrictions, get that fitness for duty taken care of. So, yep, I'd send it to them and, you know, or emergency contact if they're completely incapacitated and they're not able to, you know, talk to a doc themselves.
I would even often ask if they could get me the doctor's fax number.
Or
Or at the hospital, if it was at the hospital, it's a
Right.
little harder with hospitals. They look at it on paperwork like it's time bound. They have no clue what it is. But if you ask for a specific doctor, I just went through that. If you go and say, I would just often, if they're in the hospital, I would say, hey, can you get me your doctor's fax number? Doctors don't like email, they like faxes still, believe it or not. So, you know, can you get me your doctor's fax number and I'll fax him the medical paperwork so we can get that rolling. But send that first notice to their home. Okay, the one that says, yep, you qualify, we're waiting on paperwork, this is when it's due. You still need to send that to them or email that to them. But if you want to be especially nice, that's what I would do. It's fine.
one last thing, if I may, sorry. So sometimes I get this question from employees who say, you can't make me take, I don't want FMLA, right? You've heard this, right? You know, there's a really great message there. This is an employee benefit. Having job protection is something that those of us in the labor force in the early 90s, before 93, when it was enacted, we never had that job protection. So this is an employee benefit. This provides for them the legal protection to be able to keep their job. Insurance continuation. So, you know, this isn't a bad thing. It's just be clear on your messaging as you're having these conversations with folks, because there's a really positive spin that we can put it on for people, and they don't have to feel like FMLA is something that's being done to them. Okay? It really is for their benefit.
Can you still apply FMLA if they still decide not to return the paperwork?
No, because if they never return the paperwork, the leave's not protected.
We have tough decisions to make.
Right.
Yeah.
Good question. All right, a couple common questions here. I think this one falls under supervisor.
Yes. For some reason, the first part did not.
Yeah, the question is.
The question is, can the company ever deny FMLA? If you train your supervisors, you're going to get payments. And what they're going to say is, I can't afford to have so-and-so gone. There's no way. The company, if the person qualifies, they've been there a year, 1,250 hours, if they have a condition that qualifies and they do all the proper paperwork, the company cannot deny FMLA. They just can't. Your controller can't deny it. Your CEO can't deny it. Doesn't really matter. You know, even there are some circumstances where you can deny bringing them back, but they literally have to be in the top some percent of pay and the key employees, basically your CEO and your controller. And who's going to fire your CEO or your controller, really? So you can't deny FMLA. It's not a thing. As long as they properly document it, the condition qualifies, they qualify. As long as you're an FMLA employer, it's a must.
Oh, here's the question. Next question, can I transfer an employee on FMLA?
Yes, but I would say really in reality, no. If the position does not accommodate, because you only do it first of all with intermittent leave, which why would you do it for long term? Not there. They have to transfer to a similar type of position. You can't move an office employee into the plant or to the reception desk if they're a manager, or, you know, it has to be a very similar type of position. And they have to have the training and skills to perform the job. And their pay, benefits and everything else has to stay the same. You pay your receptionist what you pay your purchasing manager. I wouldn't. Upon completion of FMLA, they have to go back to their original position or a substantially similar position. That question about the machinist, if they're on a different machine, but they're trained to do that machine, yes, you can return a person on the line to a different spot on the line, as long as the, you know, you don't want to return a supervisor to a line position or a lead to a line position. That's no. So it has to be substantially similar. So in reality, the answer is kind of no. There's other things. I'm going to eat that. What? Sorry.
Oh, I
Nope,
just
you're
got,
okay.
I got you.
Oh, I went too far, clearly. What they need to really think about is alternatives. What I'm going to do if. The same kind of alternatives you make when you think about what if this person leaves. What am I going to do? You can hire temp. You can run overtime. You can assign critical issues to colleagues or to the boss. Can the duty be automated or outsourced for a period of time? Can you offer, what I did, I had a third shift supervisor who needed intermittent FMLA leave. You know how many third shift supervisors we had? 2. And so the other one couldn't take over all that work. What we did is we told the lead, hey, this is a great time for you to learn your wings as a supervisor. So when this person's going to be off, we're going to train you, but you're going to fill in. You're going to do the time and attendance. You're going to tell people what their assignments are. You're going to bring any HR issues to HR, and we will pay you a little more on those days to acknowledge that this is a lot more responsibility. And this is a way so that when we post an open position, you've already got some good experience. And so that's a good way to work with it. There is one thing. If somebody's on intermittent leave, you can request that they make planned absences around critical work issues. Doctors that are specialists are not flexible. So that's not one you're probably gonna be able to single out. But for example, if I've got to get treatments every week and I'm the payroll person, you can ask me not to do it on payroll day. Or if I'm an accountant and we do the books the first 3 days of the month, you can ask them not to do treatments the first 3 days of the month. And that's very reasonable for planned absences, which of course not all of them are.
Through here. The next one is on social media. You want to briefly touch on this, Connie, and then I think we're going to skip over to the work comp.
When you have people on FMLA and people start begrudging that, particularly if they're a Friday, Monday, day after holiday kind of FMLA person, you will get coworkers that are seekers of injustice, and they will see their friend on Facebook or Twitter or, Insta. Look, they were out on the beach and they said they called in for FMLA. Fire them, fire them, fire them. You definitely need to consider that. But what the law says is you need to consider that with doctor's input. And the example I will give you seems really crazy, but it was a recent court case. A woman had depression and she called in, didn't go to work that day. She went to a Beyonce concert. Selfie, I'm at the Beyonce concert. And all her colleagues are mad. She called in, she went to the Beyonce concert. They fired her. They never talked to her psychologist. And the psychologist said, well, if somebody's depressed, I think a concert might be a good thing to pick up their mood. And that's not inconsistent with being on FMLA. They lost a huge settlement. There are some things that are probably a little more obvious. If somebody's off for a knee injury and you have pictures of them rock climbing, that might be a little closer to something that's not as controversial. But my point would be, always make sure when you see these things to respond, not react. And I would definitely involve counsel and the person's doctor. Don't just assume people have taken vacations while on FMLA, and that's not necessarily inconsistent with their injury. Okay, so there are things you need to really consider the physician and your attorneys.
I'm going to now skip forward to slide 42, because I do think that we touched on the termination after FMLA leave. There's an ADA. But I know that folks will be interested to get answers on the intersection of these two policies. So.
Very, very brief, just so I hear it again, and get it through my next call. Both criteria need to be met with the 1,250 hours and 12 months in order for them to qualify. So if somebody has worked 1,250 to date, but they haven't been on for a year, they do not qualify, correct?
Right. So you hire somebody in the spring and they tap out at 1,250 hours pretty quickly because you're working overtime, right?
Yep.
But if they haven't been there the full 12 months, then.
Thank you.
Yeah. All right. Kimber, you have this one in front of you?
I do.
Okay.
So FMLA and Michigan work comp can run concurrently. All FMLA requirements apply. And then we talked about the certification and making sure you have the proper information from the physician. And it's important to know that even once FMLA ends, if they're still on work comp or still treating for that injury or illness, the work comp benefits don't change. So they're still kind of, I don't want to say protected under work comp, but there's still work comp things that we need to take into consideration before we think about termination or things like that. So it's a little bit different that FMLA ends, but we still have to address sort of that work comp issue that's underlying.
So if we have an employer here who doesn't have the 50 employees in the prior 20 calendar weeks, right? They don't have to comply with FMLA, but they have a work comp claim. Can benefits be terminated? Connie?
Oh, that's a good Kimber question. I did not until, I've always worked for FMLA employers.
Okay. So in that situation, is there really a reason that the insurance contract would cover that person? Nope, there's not. Now, remember, as the employer, if there's a Cobra situation, you can help pay for that Cobra premium to make it look like they're still an active employee and receiving that benefit. But there is no protection for them while they're gone, okay? All right. Sorry.
No, that's fine. So, Michigan Work Comp and Cobra. So you can put an employee on Cobra if they're on Michigan Work Comp. And the thing to consider here is that if they go on Cobra and they start having to take on the cost of those premiums, it will be considered a discontinued fringe benefit, which could increase the amount they're getting paid on work comp. So it's just something we kind of want to look at, long-term, what that offset looks like, what they could potentially be working. They could be getting paid more under the work comp, which could be increasing the cost of that claim. So when you get to that point, it's important to have a conversation with your work comp adjuster and us if we're available to kind of make that decision moving forward.
Any questions on how those two policies would, or those two protections would apply?
So the work comp with the Cobra. So someone has our insurance, they're scheduled off for surgery. What's the time frame that it's supposed to switch over?
To Cobra?
Yeah.
All right, so their last day work would be that triggering event. Now I can't remember, are you guys FMLA?
They're not yet.
You're not.
Just scheduled.
Okay, all right. So in that case, the last day work would be the trigger.
Okay.
Does it sound harsh to you that if there's a situation?
It
that-
does
yeah.
a little bit, but, so then if we're switching over and say now we're also FMLA. And then, of course, so I'm gonna calculate and count that time that they're off on work comp as FMLA time?
If it qualifies.
Okay.
The injury has to qualify. If they're having surgery, that's gonna
It
qualify.
qualifies, right. So I'm gonna start from the first day that they're off for surgery and I'm gonna start their FMLA time, but at the same time, they're also on work comp.
Correct. And you always
And
want to do
Cobra.
that when you can.
So they're getting all of
The
it.
issue with Cobra is
Well,
that. I'm sorry.
You're not gonna run Cobra while they're still on FMLA, because they're gonna be covered by the group health plan at that point.
Yep.
But once they exhaust the FMLA, that's where you're gonna send that election notice and say, hey, do you wanna purchase at your own expense the Cobra
Got it.
Administration coverage?
Okay.
The rule for insurance is you have to be actively employed. That means you're working and getting paid, you're on paid time off like vacation or PTO. FMLA is considered actively employed under insurance plans.
Okay.
Other forms of unpaid time off are not considered active employment. And I know people want to be nice, and I will tell you, before I had OVD as my broker, I was very, very guilty of letting people go on personal leaves and continuing their insurance. The problem happens if they incur a large claim and that claim gets audited, and you're going to be really stuck financially. And so you don't want to get in that situation. If you as an employer decide we will continue it through Cobra, and that's what we did. We made them actually elect Cobra. We would pay our part, they would pay their part. But we always made them elect Cobra if they went on personal leave, for example.
So let's look at this in a timeline, because it gets muddy, right, when you're actually doing it. At your office alone with no one to talk about it. So let's just say that Sally is off of work on Wednesday. There's a work comp claim and they're off on Wednesday. I would not submit that Cobra qualifying event that day, because we have that 7-day period, right, where that could still be just a medical leave, right? So I would wait until you know if that claim is going to turn into a long-term indemnity, but don't go further than 30 days before you make that retroactive adjustment, right? Because we have to get out that Cobra qualifying event notice, and insurance companies often don't let us terminate coverage back past 30 days, and then you're on the hook for that whole month's premium. All right. Any other questions on that? We'll skip forward to Cobra interacting with FMLA.
Fun never ends.
Never.
Okay, so this is pretty basic though, and I think I just kind of covered this. So under FMLA, employers must maintain the same health benefits during employees' FMLA as if the employee was still working. That's something you've heard us say all day long. It's like they're still there, like nothing has changed. But there's a couple of exceptions. So coverage may be terminated during a leave if an employee's payment is more than 30 days late. We do have to give them some notice. So there's a 15 days written notice that we kind of talked about. Again, your Cobra Administrator will help you with that documentation as well. And the employee notifies the employer that they're not going to be returning to work. So thanks, I had my baby. This baby's pretty darn cute. I really like that baby more than I like all my coworkers. I'm gonna stay home with that baby. Okay. The employer terminates the plan, doesn't happen very often, and the employee does not turn to work. But just keep in mind, Cobra doesn't begin until the coverage lapses at the end of that FMLA leave. And also keep in mind that ADA, so if they are still on leave, they've exhausted their 12 weeks of FMLA job protection, but they still have a disability, so they might be on an extended leave under ADA. That generally doesn't include the continuation of healthcare premiums or healthcare coverage for that employee. So ADA is usually when that stops. And I often see policies that say, actually I put like a sample one in here, but again, I'm not an ERISA attorney, but you might want to have a policy that says, as a generality, benefits don't exist or, extend beyond, the 3-month mark or, something like that, just so that that's clear. Because sometimes individuals think, well, I'm on ADA leave. How come you're not going to pay? How come I don't get my healthcare coverage anymore? So it's important to make sure though that you are very much aligned with what your handbook says, matches what your insurance carrier says, and your health plan documents say. That everything is, if you don't know when that is, and the actively at work statements, like making sure all of that is really clear and buttoned up is a great best practice. Okay.
Can I say something on the tail end of that?
Yeah, please.
So sometimes employers will put into place an FMLA lookalike policy. So it might mean that for people who aren't technically eligible for hours, right? So in that situation, remember, contracts have to match contracts, have to match policies. So make sure that those are all in line when you're doing those lookalike policies.
Yeah. Good. So just a couple of closing points, and we're going to lose our computer here. So just a couple closing points about the subsidy. There's a special rule for involuntary terminations when a leave of absence is due to an employee's illness or disability there. So voluntary, reasonable expectation the employee will return to work from the illness or disability. Voluntary, there's no reasonable expectation the employee can return to work. So just, I recommend going through that interactive process that we talked a little bit about earlier with regard to the ADA as well. Then I've got some case scenarios, but before we get to that, maybe I should stop there and see if there's any more questions from the audience, because how are we doing on time?
We don't have any more questions on the chat feature. So anybody here?
Okay.
Let's do case studies.
Okay. So these are really about the subsidy, whether or not somebody qualifies for the subsidy. And again, I waffled on this one because I'm like, man, it's probably going to sunset here in the next 30 days, but maybe, yeah, we'll kind of see. So we've got Beatrice, right? Beatrice is on her leave of absence. She contracted COVID-19. She's on FMLA leave. Her leave of absence ends here June 24th. The physician says she should be able to return to work mid-July, so after FMLA leave would be expired, okay? The company says, okay, fair enough, doc, we'll let her stay off, because she's still disabled, and we're gonna extend not FMLA coverage at that point, it's more like an ADA coverage, and it allows Beatrice to maintain her health care coverage during the extension. She's unable to return, but her physician indicates he will clear her to return to work maybe in August. Well, they said, well, now wait a minute, we're not going to do that anymore. Do you think she qualifies for the subsidy? Dun, dun, dun. Yeah. So the leave of absence did not cause a loss of coverage since she remained eligible for the coverage at the active rate. We believe that her termination on July 16th is an involuntary termination, making her subsidy eligible because there's a reasonable expectation she would have returned at that point. So generally the answer would be yes to that one. Okay. Showing up? Yes.
Yep.
All right, good. Sorry, we're having a
battery issue.
We're having a battery issue over here, yeah. So Joel's in a car accident. We'll take one more case scenario. So Joel's in a car accident in February, was concurrently on disability and FMLA leave and declared permanently disabled in late April. So his disability ended, FMLA leave ended in May, and his employer terminated him the next day. And he transitioned to long-term disability. Do you think he qualifies for the subsidy? Tati's telling me no. She's right? Because he wasn't able to come back to work. He wasn't able to return to work at that point. And it's not an involuntary termination. This may seem counterintuitive because he feels like someone, who would need the services of Cobra, but he's no longer able to perform services, and there's no reasonable expectation that he'd be able to return to work now that he's permanently disabled. So you can see where the Cobra gets to be a little sticky as well. Again, hopefully this sunsets in a little bit of time, but those are a couple of different scenarios that you might be experiencing in your life. That's all I have.
All right, before we wrap up then, are there any other case situations that you're dealing with right now that you just want to throw it out there and get some feedback on? Okay.
So as somebody, as a company going into that FMLA program, if you will, there's literature that has to be posted about FMLA, right? Do you recommend including some of that literature like within handbooks?
Yes.
Basically mandatory.
Yep. So Bruce would be able to send over a sample FMLA policy, which you can just drop right into your handbook there. That's just a sample. But we always just recommend that whatever attorney reviewed your handbook originally, make sure that it agrees with everything else that you have in your handbook.
Thank you.
And then the poster, you'll want to post probably just right next to your compliance posters.
Perfect.
Any other questions?
What's the proper way to count weeks? Is it literally just like Sunday to Sunday, Monday to Wednesday?
That's a great question.
So her question was, what's the proper way to count weeks? So are you referring to like the 20 work weeks, having?
Like 12 weeks when I'm approving them.
So
it.
I don't know. That was
In a perfect world, the employee, they work through Friday, their leave starts on Monday. So that's super obvious, right? After 12 weeks, they come back on the 13th Monday. But if somebody goes in, on a surgery on a Wednesday, you start on that day. So do Wednesday, Tuesday, Wednesday, Tuesday, Wednesday, Tuesday. And then those are going to be your weeks.
For intermittent, I've been reading some information. If you have an employee that regularly works 6 days a week, then those weeks if you're counting hours, you can't use 480. You have to use what they work in a normal work week times 12. Now, if it's just occasional overtime, I'm talking about there are plants that literally work Monday to Saturday every week. So you have to consider what their normal work schedule would be.
All right, wonderful. Well, thank you so much for joining us. We are happy that you could be here for this summit.